Good day, Dr. Sasot. Good day, panelists and co-researcher. Today, we are honored to present our study titled, Pero Bakit Parang Kasalanan Ko? A discourse analysis of Filipino medical frontliners who were tested COVID-19 positive. The first part will be discussed by Truly Yours. I will begin with highlighting current background about our medical frontliners, then present our research question and state the chosen framework for our research paper, followed by Ms. Ida Valenia on discussing the methods, our research design, participants, instrument, and procedure. Then Ms. Michelle Ana Bundo and Ms. Raquel Cantos will present the core of our study, the result, and discussion. And lastly, to sum up, for our conclusion and recommendations, Ms. Annabel Del Rosario will be the one presenting. To begin with, let's start with a brief introduction. Lack of pandemic preparedness, supply shortage, challenges in enforcing social distancing, delay in testing, full rooms, understaffed shifts, delay to no salary increase. Those are some of the struggles that our medical frontliners endures almost every day. But despite the hardship and health risk, our frontliners continue to do their job during this COVID-19 pandemic battle, not to mention balancing their responsibility over family. Pero paano kung sila naman ang tamaan ng COVID? As our government action to pacify the COVID-19 pandemic, the Bayanihan to Heal as One Act was signed and set as a main support for our frontliners. Social media posts, videos, tributes, songs, and even thousands of messages are dedicated to honor and appreciate their hard work. However, such admiration did not stop the dangers that are regularly faced by our frontliners, like discriminations, moral injury, and worse, blame once they contracted the virus. Given those significant related study, we come up with the following research questions. What are the dominant discourse of Filipino medical frontliners who were tested COVID-19 positive in terms of interpersonal and intrapersonal discourse? What are the subjective grievance that the medical frontliners felt when they were diagnosed as COVID-19 positive? How do the medical frontliners position themselves in social acquisition and impose culpability on them? And how do the frontliners seek and continue to find meaning despite the adverse conditions they face? FDA, or the Foucauldian discourse analysis, as our main framework that was used to explore how our participants express and communicates their responses towards their construct of being COVID-19 positive. To further explain the method and its subcontext, Ms. Ida will discuss it further.
For the methods of our study, participants was targeted for the following criteria. They were healthcare workers employed in government hospitals in Manila with confirmed COVID-19 infection. In the end, we interviewed 7 regular healthcare workers as our participants. Due to the COVID-19 outbreak and for the convenience and safety purposes, the interviews were done online through Zoom or Google Meet applications. And it was guided with a semi-structured interview questionnaire. At first, we sent them an initial invitation through their respective emails with our intentions and short background of the study. And once they approved, they sent back the informed consent and settled the interview date upon their convenience. And here are the results of our study that will be discussed by Michelle Abundo.
As mentioned earlier, one of our research statements is to know the dominant discourses on Filipino medical frontliners who were tested COVID-19 positive, starting with knowing the respondents' perspective about COVID-19 pandemic before they were tested positive. Some of the respondents felt worry about their loved ones as a result of contracting the virus and having uncertain feelings on acquiring the virus. As a medical frontliner, they are able to protect themselves knowing that they are at risk in getting the COVID-19 virus. By having strict compliance to minimum standards of health protocols, since they are expected to work with the highest level of protective equipment and strictly comply to the standards of hospitals' health protocol. Their personal experiences while waiting for the result of the swab test is more an uneasiness since most of them are already experiencing symptoms prior to the conduct of the swab testing. In terms of COVID-19 disease severity classification, their classifications are varied from symptomatic, asymptomatic, and moderate cases, and even their quarantine location, which is under home or quarantine facilities. Most of the respondents' reaction were feelings of shock, anxiety, and loneliness upon knowing that they are COVID-19 positive. It was supported by the participants' feeling of losing oneself and confusion as seen in some of their statements. In processing their thoughts and emotions after knowing the results, they have negative emotion such as worries, discomfort, feelings of disappointments. Further, while some of the respondents turn their emotions into a more positive manner by depending on their faith in God, accepting the sickness as form of challenge, avoiding overthinking. The reaction of the people around them after knowing the situation is a mix of blame, sympathy, and support. In responding to their feedbacks or comments pertaining to their situation, some of the participants' response was assertive and don't take it negatively, while some are under apologetic for the exposure happened. The experiences and challenges during the quarantine treatment period they encounter were feelings of stress, anxiety, depression, and feelings of deprivation considering the length of stay in the facility. Their motivation and coping mechanism during the recovery period are support systems of their family members, colleagues, their faith doing recreation, and productive things that will divert their attention into something beneficial for them. They prepare themselves for the adjustment before returning home and reporting to work by clerical, occupational, health, and psychological preparations, extensive cautionary practices, and encountering stigmatization. Further, after their treatment quarantine, they are treated by their peers, colleagues, family members with pure concern and compassion. Lastly, some of the insights or realizations and learning they gain in this COVID-19 pandemic experience focuses more on the intrapersonal discourse of distress. Do not underestimate COVID-19. Support system is important. Advocating against stigma, commitment to service prevail. And to further discuss the discussions, here is Ms. Raquel Cantos.
Findings of the study have implications too. First, with extremely high infection rate and relatively high mortality, individuals naturally began worrying about the COVID-19 and have fear of contacting persons who are possibly infected by the virus. In the results, along with the related study, it is very clear that COVID-19 does not only attack the physical state of a person, but also his or her psychological and moral state. Second, the results of the study showed how participants have become adherent to strict protocols. But despite of such practices, they have still failed to prevent contracting the disease. This was supported by the previous studies of Chalmers 2021 that postulated how COVID-19 abolishes forms of invisibility. In terms of psychological strength, the results have also recognized how even the professionals who are educated of science and cautionary standards are still susceptible for fear and vulnerable in getting COVID-19. Third, this study revealed intense release of emotions and distress among the respondents, especially in the phase of their isolation. Sanderson 2020 found out that patients, upon knowing that they are positive with COVID-19 virus, has maneuvered their feelings of either worry, agony, and distress. People have different responses when it comes to the coronavirus pandemic. It is proven to be rational as patients who are diagnosed as positive with COVID-19 virus and are compelled to conduct home quarantine or be restrained had experienced panic, fear, moral injury, guilt, grief, and anxiety. Fourth, frontline health workers have experienced negative responses from colleagues and loved ones with criticisms and blame. These are rooted from either self-accusation beliefs of the participants or the people around them. In the study of Bagchi 2020, doctors who were once positive with COVID-19 experienced extreme stigma from coworkers, while according to the study of Manowar 2021, these are usual responses from the public on cases where the supposed protector of the people was not able to protect themselves from the injury he or she was supposed to be battling. Fifth, frontline healthcare workers' resilience comes from the support system, and they remain positive despite of having the virus. During their journey towards sickness and recovery, they have made their faith in God, family, friends, and other activities as the source of strength. Sixth, upon recovery, frontline healthcare workers have made their arrangements centered on their comeback occupational services because for them, their oath to serve is more significant than their overall COVID-19 experience. Seven, it was found out that the genuine expression of gratitude and positivity is powerful. It honors and could reinforce the compassion of healthcare workers who risk their lives to help patients infected with deadly disease. According to Zinger et al. 2014, reinforcing their compassion helps them overcome the stress and fear to provide care under difficult clinical circumstances. This study may only be applicable to healthcare workers who works in the hospital setting. It does not involve participants working from the barangay and LGUs. Second, the lived experiences of the medical frontliners. The researcher did not explore the experiences of their relatives, family, colleagues pertaining to their reactions and experiences in dealing with them, knowing that they are working in the hospital setting. And lastly, healthcare workers who tested through positive. This is that it does not explore the experiences of individuals who tested false positive and negative.
Based on the summary of findings, the following conclusions were derived. Despite of strict adherence to health protocols, results show that participants have feelings of guilt, remorse, and apprehensive disappointment upon knowing the result. On a negative lens, some of the participants have responded with confusions and blame, ensuing that the respondents have not become disciplined enough to counter prevent the virus. Some even experience receiving judgment, offensive remarks, and discriminations. The respondents prior to getting the COVID-19 infection have partition point of view on its capacity to cause death. Emphasis on how the virus can be transmitted constantly by the public crisis from the Department of Health added to the presumption that the virus is undoubtedly dangerous. The interpersonal discourse centralized on personal ambiguities, fear and worry towards family members, and duties left behind. The intrapersonal discourse is governed by impacts of discrimination by others. They have experienced subjective challenges because of self blame, alongside psychological, physiological, and financial difficulty on monetary obligations of the mounting of hospital bills, among other due dates. They have positioned themselves as guilty for acquiring the virus, which have intensified implications of psychosocial and moral injury. And on a negative point, some of them have reacted with fault, resulting that the respondents have not gotten trained enough to counter prevent the infection. For our recommendation, participants consider the support of the government they have received from the local government or national sectors considerably helpful but not sufficient. Participants consider the support that they have received from the government considerably helpful but not sufficient. LGUs or national government sectors may consider allocating funds for the recovery of those who are in the front lines, primarily because they are the ones who are battling the virus. Support on them are vital to sustain continuous treatment of the other patients who are also COVID-19 positive. In terms of psychological intervention, hospital management may consider conducting series of psychological evaluations in the frontline health workers to guarantee that their welfare is secured. The study or further study has divulged the experiences of COVID-19 frontline health workers straight from their discourse. Further and in-depth studies are advised to examine paradigms that are left unexposed. And finally, the researchers fully recognize both of these objectives and subjective roles in this investigation, and based on the summary of findings, all involvements and beliefs, as well as convictions, are transparently presented in this qualitative paper most especially on the aforementioned gathering of interpretational approaches that has been examined. The researchers fully understand that these impacts can be significant for future studies. And as our final word, Out of the Mountain of Despair, A Stone of Hope by Martin Luther King Jr. Thank you and good day.